gotta go back and
We'll
talk.
go back.
The next issue is the parking revenue, increase in parking revenue. Again, that won't happen at the introduction of the budget. We do have a study that will give us some insights in terms of the parking study that may be helpful in developing those rates. So that'll happen sometime this year, so that's already in process. The next issue is the recreation is reviewing the fee structure for the use of the athletic fields. Very small revenue piece, but it's at least thinking in the right direction of charging the users for, and that money can go back into things like maintenance of the fields. The next piece was to look at creating a maintenance fee for the use of municipal property, particularly Susan Patterson Center. There are outside groups that use that. We then pay the cost to clean it up afterwards. But what we're proposing is to put together a fee that would charge people for that so that we recover some cost. Our cost like by
Public Works, for example, cleans up after. And so, right.
After everything?
Yes.
Right, and then they're getting the revenue from the rental.
And we're
Yes.
paying for the, and Public Works, is that part of Public Works, but yeah.
Yes. The next issue is the review of cross-town service. As everyone is aware, we had to do a significant increase in the budget. Is it 100? Or 40? $40,000 in those services. I've now had all the data for this year, and I'm asking for additional data so that we can look at what needs to happen. What I see preliminarily in the data, we have a small number of users using the service a lot, and it's driving up costs. So that's one question. That's one question we may want to deal with, is having some controls on the use. The next issue is reimbursement from the hospital. There are a similar service run by the county where the hospital reimburses the full ride. We only get $3 per ride. The next issue is there are people using across town that are in the area in which the hospital said they would provide taxi service. So that's another area where we should be looking at the hospital to reimburse us more of that money. So that's another area we want to look at to control that cost. I'm not sure this is a question for council, and I believe we want the service, we're looking to provide the service, but we need to control it and not let it just go kind of haywire and reacting to the use. We should be managing the use.
In the finance meeting, Bernie and I did that perhaps some of these could be tied to whether or not you were qualified for.
PAAD, yeah.
Right, were you able to pursue that in any of these discussions, that it would be sort of
Needs-based.
needs-based?
I know that I know this because I asked the same thing. I know that Susan Hoskins doesn't want to do that. I mean, they feel like it's gonna make it a
It's
lot harder to
administratively
administer,
difficult,
but I'm not saying, but I agree that maybe we should consider
It's an
that.
option to look
You
at.
know, one other thing is, like the library where we give a X amount and they sort of determine how they spend it, can we say to Susan, we're gonna give you X amount for crosstown and
You have to do.
you figure out how to drive these savings? I mean, that's what,
Well, or you can limit the number of rides. I hate to say it, but maybe everyone limit out 7 rides a month or 5 rides.
But I feel like part of the structural problem with this is that it seems like we're funding this program to an unlimited amount, as opposed to
Right.
saying,
yeah.
and more to Joe's point, and it might be like more of a, more of like a policy that we extend across the budget, that we have relationships with a lot of groups like this, where it should be, so we can plan like a fixed amount.
We need budget certainty, and so the principle, I think, that you're seeing through all of these is that where we can, people should be paying, a percentage of the costs rather than it being across the tax base if there are specific benefits, with the recognition that more vulnerable populations we have to protect, right? So
I
how
think
do
we
we
should-
weigh that?
I think you hit the head on the nail as far as I'm concerned, especially for this service, because
Boing!
I know lots of very wealthy elderly people in this
Yeah.
town, we all do,
Yeah.
and why should the taxpayers be paying for rides for them? I mean,
Right.
I
And so there's a
to be-
convenient service, but they can contribute. And what I think what you found was that a small percentage of people are using it a lot.
Yeah.
And they may be, if somebody's on dialysis and needs it, I
Yeah.
mean, we want them to be able to access
of
it.
course.
But that
But
needs
not
to
to take it to their job.
Yes.
But that needs to be managed,
Yes.
but that needs to be managed a little bit. If there's somebody who has a chronic need and is going to dialysis and needs that, we absolutely want them to be able to do it, but not, so I think it's a good idea, this idea of, we don't have the expertise to do that, for that to be sort of turned over to the management of the service to say whether it's sort of, you sort of cap it or just to say this amount and figure it out, and, you know.
And I think we just need to make a policy decision on what are the issues that we want to deal with. One, is it going to be a needs phase? Are we going to limit the service? So these are some of the things that once I finish looking at the data, I'd like to bring back to get the policy, and then we can have someone
Well,
manage it.
and I'm more than willing to hear from Susan how she would limit it, you know,
Right.
this
Okay.
is the direction we're going.
But
You tell us who the neediest people are.
Well, I don't know, I mean,
The counter to the argument that was made before about not wanting to put it on a need-based service, as a need-based service, if you look at that handbook that the Senior Resource Center hands out, in that handbook, it shows you, it tells you how to get PAAD, that's assistance with prescriptions. It tells you how to get assistance with utility bills. And if they're telling people that those are need-based services.
Exactly, that becomes the proxy. You don't have to ask people's income. If you're on PAD, that means you're qualifying for the program. It is not that hard to be able to do that. And if they're helping, and we want people to be signing up for these services. So it should be aligned. It should be, so it could be free for anybody on PAD and then co-pay for anybody not.
yeah, I mean, do we all agree on that, or is that
I mean, it
just?
seems like that should be the guiding principle, just where.
Well, I don't know how many people are on.
Because
I'll
I
let
don't,
you say.
I mean, I don't think we should pay, I personally don't think we should pay for rides for people who can afford that. So I don't know, that's,
I think what Susan would say though, in the opposite, is that we don't want to stigmatize
Yeah.
low-income people and have different categories. And when you think about sort of our Medicare program,
Social Security.
Social Security, they're not.
I know.
And then of course they have broader political support because they're, because they're broadly, they have broad eligibility. So I think her point would be that you don't want to stigmatize, but there's got to be a way to do it where you're.
Right.
We do this with school lunch programs. We do
Yeah,
this with
sure.
actually send hunger packing.
Sure.
Where you can be generous for
Yeah.
people who most need it in a way that does not stigmatize. And that's
Absolutely.
what- and I think, the through line here on all of these, whether it's parking, compost, all of that, is that, because of our budget crisis, we need people, it's fairer to assess it on the people who are using it if they can afford to pay, right?
Yeah, that's what I wondered if that, I mean, was that something that was assumed by the finance committee?
Yes, that's how we talked
Yes.
about it.
And
Yeah,
Mark's-
because I agree with that wholeheartedly.
Mark's, yes, and Mark's trying to tease this out, but at a point, how
Sometimes
much,
it's hard to operationalize.
yeah, how
Right,
much time are we
right.
gonna try to, spend on this? Because as you said, even if we, this caught us by surprise, so it got our attention, but at the end of the day, one police person.
Right.
The other issue, I just don't want to get lost, and it is, I think we need to have fixed numbers in the budget and not run into the problem that happened this year where we suddenly got a bill
Or to no benefit
for a
of
lot
town.
more, yeah, exactly, it
Well, I
should be
think-
fixed, and then the
That's-
other,
okay.
and then the other thing that's semi-related is just how the grants work. Like for a department like Corner House, where a lot of the budget was coming in through grants, and then if the grants dry up, it seems like it's baked in that then the municipality
Yeah.
makes up the difference. And I think we also have to we just wanna have certainty so that we don't get hit with, $100,000 more because federal government's deciding not to fund something. We need to have the discussion then, instead of it being automatic that we're gonna pay for it, I think we need to have a
I
discussion.
totally agree. I worry that we get a grant and we hire somebody new, and then the grant goes away and we're still hiring. I mean, the summer youth employment is the opposite. It's something we've been using our money because we thought it was a priority, and then there's a grant for it, which is great, but there's no staffing involved. I mean, the concern is when there's staffing involved, and then you're on the hook for infinity, right? And so
Or
how do you
programming that gets absorbed.
that gets baked into the
Right.
base?
Frankly, my philosophy in terms of grants, particularly as a general rule, I don't like grants for salary wages because they are continuing expenses.
But it seems
So I
like
agree
that's
with
the
you.
case.
We have some that are that way. One of the things that you'll see in the budget under Corner House, you see there's a reduction But there's also what we try to do is say, look, you've gotta make up the difference. That's why there's an increase from the foundation and a decrease in the salary and wages make up. So my assumption is if you lose grants, then you've gotta make up the difference somehow. It's not gonna be an automatic thing. That's not what we've done. it.
Well, and the foundation stepped up, right?
Yes.
And we've got a bigger, but Sandy, isn't some of the problem with Corner House is that they changed the way the billing?
Yes.
And so they can only bill for services that are actually rendered now?
Yeah, there was a change that was made in July of last year.
Right.
They used to bill the state, now they have to bill Medicaid and the insurances, so it's a little bit different. We're actually hoping to recapture more of our costs, because of the way they're gonna be doing it, because the hourly rate of what they're reimbursing now is higher than it was in the past. So the end of last year was sort of a, you know, an iffy for us because we weren't sure what kind of revenues we were gonna get. So taking on a whole new year with doing it the new way, I think will, in the long run, be better for Corner House.
Right, so in the past, they would get a grant, and then they would see however many people that they saw.
Right.
Now, they don't get the grant up front; they have to
It's episodic reimbursement,
bill,
yeah.
right.
Correct.
So if the demand, you know, it's not that Corner House is somehow mismanaging,
It's
they
just hard to
can't help
plan.
it either.
Right.
They're-
It's hard to
it's-
plan.
Things have changed for them as well,
Right.
so they're in a bit of a bind. I mean, it's
Yeah.
great that the foundation stepped up, but it's, you know, it's not as if they're not doing their job.
No, and I didn't mean to imply that either. I think it's more just, we have to be careful that we don't get left holding the bag if there's an issue, and that we just need to be intentional about it.
Well, who's gonna hold the bag? I mean, it's not, it's, the state changed the way they did the funding. Unless we're gonna, I don't know how we eliminate that risk.
I think the issue is, at some point, what was happening is, and I think we fund a portion of Corner House would go up every time there's a decrease in grants. And what we're trying to do now is saying, look, we've got to manage this a little better, so if the grants go down, we need to look at operations, and if you can make cuts, you can make cuts. If it was to a point where it would impact service delivery too much, I'd come back to you and say, look, we need to fund this additional amount. Whereas before, it was just kind of happening automatically, and, you know, just without that conversation. I think you need to have that conversation.
Well, are we having that right now about Corner House? I mean.
Well, yeah, I think that's why they.
They made up the difference,
I mean,
it's not an issue.
I mean, because I do think we should, I think we should look at it really, you know, intentionally and say exactly what you just said. Corner House gets grants. If you don't have the grant, you can't, do we wanna say you can't provide the service if you don't have the grant? That's the question, right?
But
Yeah, and the question is what
they
it-
changed the billing, so they can't
Well, I
provide the
understand.
service. They don't get the grant up front, so they
I
don't know how
understand
much
that
they're
for-
getting. They have to perform the service and then bill
Indeed.
for it.
But so they're gonna have to start figuring out how to budget for that, right? I mean, isn't that what,
Yeah, and I think what all this means, it simply means is that if there is an issue where we needed to increase our funding to maintain the service level, I would make sure it comes back to you intentionally. Whereas before, I'm not sure you realized that it was going up and down. At this point, you would make the decision. We would come back to you and say, look, there's a shortfall in the grants, Corner House, the foundation can't take it on, we can't make reductions in the budget, we're asking for an increase in the municipality side, and you would make the decision as a policy decision, do you wanna do that or not?
yeah,
I
that would
wouldn't,
be good.
I don't
So
wanna
we-
automatically say, we're gonna reduce services, because they may not be able to do that and provide their core services.
Right, just so we also know exactly what we're talking about too, like, are we talking about the, you know, the school programs, are we talking about the, counseling programs for drug addicts? Like, so I think it would be, I really support that, I'm glad you're doing that, because I just think it's like all things, we should really know what we're intentionally charging taxpayers for.
Well, and I would just add another thing, this is another where federal landscape may impact here. If ACA is repealed, this
Yeah.
change is
Oh.
repealed, and we'll change
Yeah.
all of that, and there'll be a lot less money going in there. So, which is not just a Princeton issue, obviously, but we'll have to respond. So like the federal landscape really adds uncertainty.
And I think we've kind of talked about this earlier, one of the big issues is looking at police. And I think we really looked at police in terms of staffing. And one of the pieces in terms of staffing, if you're going to reduce staffing, it will definitely have an impact on the service delivery, as the chief indicated, and it will be SNU and the traffic division. But there are other opportunities within the departments. If you're aware from the strategic plan, one of the things that the chief talked about in terms of the long term was, and we're gonna push that forward, is how can we civilianize administrative functions? And that's one thing that we're very intentionally looking at this point. Are there areas that where we can make those changes? And I believe we should have some proposals that we can bring to council before the budget actually goes up for final adoption, where we'll look at that and see where there's some potential areas where we can do that.
And just to add to that, and what hopefully happens then is, again, you're not using trained police officers on things that you don't really need a trained police officer
Right.
on.
I mean, how much of the community police could be done that way? Like, you know, like, for instance, the bullying program, you know?
That's a good question. I mean, we've been thinking about more about like administrative tasks,
Yeah.
like, you know, my pet peeve has always been why do
But
you
part of
putting
that,
out the press releases to be
Yeah.
an officer, like, you know.
Yeah.
I mean, to me, some of that, the bullying stuff, I think the point is if you're building relations with the police, is do you want police? Do you want
You
Buddy
want the police
Leonard at the
officer.
school, right? I mean, it's like, people
It's
say
relationship
officers, yeah, but there are other places where do you need, I keep going back to the press releases, do the press release, the PIO function have to be?
Yeah, that definitely seems like a good idea.
You know?
And also, you could, rather than someone who wanted to be a police officer, you could get someone who wants to be a public relations
Right.
and has those skills. I mean,
Right.
ours have some good skills,
Right, but it's not
you can
necessarily
even-
in alignment,
you can
yeah.
improve
Yeah.
it.
But can I, about the police, Bernie, was it Bill Metro, who made the, for CGR, who did the various staffing models? Was it Bill Metro? Do you
No,
recall?
I don't.
It was a
No.
different, somebody
Bill-
different did
Bill-
those?
Bill was excluded from doing anything that might result in a
I
contract.
was just trying to,
during-
I mean, I
during the
wouldn't mind
consolidation effort.
taking a look at that
Yeah.
to dust off the
No, there were a
consolidation
number of
recommendations.
models that were laid out during consolidation, ranging all the way from staying at 60 right on down to, I think, 47, 48,
Right.
something like that, that were pushed very hard
Right,
by a number of people. And once again,
push back again by the
Push back.
police.
But Joe, you're raising the point, like, who was it? Was it CGR staff? Was it?
It came out of the consolidation
It was the-
report,
it was
I
the
can't
couple
remember whether
members.
it was,
it might have been CGR.
subcontracted or whether it was CGR, but they seemed to have some professionals involved that
Yeah.
developed, you know, there was the Iowa model for staffing, there were different models that were brought up. Because there are a couple of things that I think we're hearing is that we're gonna get pushback every time we look at this, whether it's Public Works or whether it's the police, they're gonna push back, as Heather identified it, and I think in our finance meeting, is the Washington Monument Syndrome. It's like, okay, you wanna cut it, well, we'll have to close the Washington Monument, every time we talk about cutting the federal budget. And the same thing happens locally, they pick the one thing that, you know, perhaps we have a lot of pride in our safe neighborhoods, oh, well, we're gonna have to cut safe neighborhoods. So, you know, I
Yeah.
almost feel like we need a separate, dispassionate look at it from, you know, and it's the
Yeah.
one thing I know that we could go back and maybe dust off that model and take a
Yeah,
look at.
I would say that I do feel like the chief has been really open and creative, and I don't think we have gotten, in terms of like all the departments, I think he's the one sort of coming forward,
Yeah,
trying to be
Joe's saying that,
creative about
that's
it,
just the
but,
risk.
but the
always
other,
is,
the
yeah.
other part I would just warn about is that that 48 model is sort of what we've been operating on.
Yeah.
And that the one
Yeah.
thing about that model that came out of that report for dispatch is that there was no backup baked into the model, and so we ran into trouble, and that was when we actually had to hire more, because there was no backup.
Because overtime.
For
is so
overtime,
important.
yeah, and that it is just like that, I think could be the difference between, I'm not disagreeing with you, but between the 48 and what we have now, it's like, that is for when people are out sick.
Well,
It's-
Mark,
I know
he
the
had
chief-
mentioned
chief-
overtime changes, actually, that, didn't he also propose
Yes.
to us at finance of changing overtime?
one of the things the chief is also looking at is reducing the amount of overtime by some of the not administrative people, like people in SNU and traffic. When he has, right now, if you're in patrol and someone calls in sick, it's an automatic overtime. What he's now doing is pulling officers from other duties to fill in those to reduce overtime, so we should see some significant overtime reduction.
Okay, all of that, but this is the sort of thing by having a little bit of pressure, you know,
Talking about
on
it,
it.
yeah.
across the board, not just police, but as we,
Yeah.
Yeah.
we bring more things up, as uncomfortable as it is, it's like all of a sudden, wow, people are finding savings that could have been found a while back.